This video is on negative phase proteins. Acute phase proteins can be classified as positive, which include alpha-1 antitrypsin, alpha-2 macroglobulin, beta-2 microglobulin, C-reactive protein, and ceruloplasmin. Negative acute phase proteins include transferrin, retinol binding protein, albumin, prealbumin. And mnemonic to remember negative acute phase protein is coming to each one of this. All these negative acute phase proteins are decreased in inflammation. Coming to transferrin. Transferrin main function is to transport iron. It also acts as antioxidants by preventing Fenton reaction. Now what is this Fenton reaction? Is the reaction where ferrous is oxidized to ferric and hydrogen peroxide gets converted to hydroxyl radical and hydroxyl ion, both of which are free radical and can damage any biomolecule. Now by oxidizing ferrous to ferric and by transporting it to its target tissue, transferrin acts as antioxidants and thus protects all the biomolecules. Next is retinol binding protein, mainly involved in transportation of vitamin A to target tissues, and zinc is required for its synthesis. Next is albumin. It's mainly responsible for maintaining colloidal osmotic pressure. It's a transport protein. It contributes to buffering capacity of plasma and blood, and also has got a nutritive role. The last one is prealbumin, also called as transthyretin or thyroxine binding prealbumin. Its function is to transport thyroid hormones T3 and T4. Coming to albumin in detail, because this will be asked as a 5 marker or 3 marker question in your university exam. Albumin, it has got a molecular weight of 69 kilodalton and half-life of 20 days. Coming to functions of albumin, it is responsible for maintaining colloidal osmotic pressure. Now, so the vascular compartment, here the proteins exert the pressure, and that is known as colloidal osmotic pressure, which is around 25 mmHg. At the arterial end, the hydrostatic or the blood pressure is 35 mmHg, and at the venous end, the hydrostatic pressure or the blood pressure is 10 mmHg. Since the hydrostatic pressure at the arterial end is more than the colloidal osmotic pressure, water oozes out from the vascular compartment to the interstitial compartment. And since the hydrostatic pressure at the venous end is less than the colloidal osmotic pressure, water is imbibed into the vascular compartment and there is no accumulation of water in normal healthy individuals. So when the albumin concentration decreases, the colloidal osmotic pressure decreases. So what happens is water still oozes out from the arterial compartment because the hydrostatic measure still remains more, but this water is not imbibed by the venous compartment. So this results in accumulation of water in the interstitial compartment, manifesting as edema. Now when the edema is seen around face, it is mainly condition is due to nephrotic syndrome. Pedal edema is seen in congestive cardiac failure. Edema around the abdomen is known as ascites, seen in cirrhosis. Next important function of albumin is transportation of bilirubin, various therapeutic drugs, steroid hormones, calcium and other trace elements. Albumin also acts as blood buffer because of the presence of 16 histidine residues. The imidazole group of histidine has got a pK of 6.1, which is close to physiological blood pH. So any protein which has got large number of histidine residues will act as blood buffer. Albumin having 16 histidine residues acts as a good plasma or the blood buffer. Apart from this, albumin also has got a nutritive function. Normal level of blood albumin or the serum albumin is 3.5 to 5 grams per deciliter, and the AG ratio is 1.2:1 to 1.5:1. Now hypoalbuminemia is of great clinical significance where the albumin concentration is less than 3.5 gram per deciliter. The conditions include cirrhosis where there is decreased synthesis of albumin, malnutrition due to decreased intake, nephrotic syndrome due to loss of albumin in urine because of damage to the renal glomerular basement membrane. Burns, albumin is lost through exposed surfaces. Protein losing enteropathy where albumin is not absorbed from GIT. Next is reversal of AG ratio characterized by increased globulins and decreased albumin, mainly seen in chronic infection and multiple myeloma. Next is kernicterus. Kernicterus is a condition characterized by accumulation of bilirubin in the basal ganglia and other parts of the cerebral cortex in the neonate, resulting in development of spastic paralysis. Now this is because albumin, being a transport protein, binds to this unconjugated bilirubin, and this complex is now this complex will not be able to cross the blood-brain barrier. So in conditions of hypoalbuminemia, so there will be less of albumin, and bilirubin being lipophilic can cross the blood-brain barrier and can lead to development of kernicterus in children suffering from hypoalbuminemia. Next is you need to know the difference between microalbumin and gross proteinuria. So microalbuminuria is the condition where albumin is excreted in the urine in the range of 30 to 300 milligram per day. And what is this gross proteinuria? When the excretion exceeds more than 300 milligram per day, the condition is known as gross proteinuria. Now this microalbuminuria cannot be identified by routine dipstick test or by sulfosalicylic or heat and acetic acid test, whereas gross proteinuria we can identify by routine dipstick test and also by sulfosalicylic and heat and acetic acid test. Microalbuminuria, it is a marker or indicator of early renal damage, whereas gross proteinuria indicates established renal damage. Now the conditions where we get to see microalbumin excreted in urine is hypertension and early diabetic nephropathy. So condition where gross proteinuria is seen is glomerulonephritis and nephrotic syndrome. One good part about microalbuminuria is it is reversible with early treatment. Now gross proteinuria, it mainly indicates established renal damage, so the condition is less reversible. So this was all albumin. Coming to transport proteins, so there are a variety of transport proteins in human body. The first one being the albumin. It is involved in transportation of hormones, drugs, trace elements and heavy metals. Prealbumin transports thyroid hormones T3, T4. Retinol binding protein transports vitamin A. Thyroxine binding globulin. Transcontin transports corticotropic hormone. Haptoglobulin transports hemoglobin. Heme is transported by hemopexin. Iron by transferrin, and the lipoproteins HDL and LDL. They are involved in transportation of cholesterol from liver to the peripheral tissue done by LDL, and HDL is involved in reverse cholesterol transport. So this was all about proteins. So next video is on blood clotting. Thank you.